Ladies and gentlemen, anatomy of a vertebra and associated structures purely from a discal and bony viewpoint. So here we have a good representation of the vertebrae as found in the lumbar vertebrae. So shall we get straight to the detail? So here we have this area here is what we call the vertebral body, this whole part of it. So there's your vertebral body. It is a load-bearing part. Okay. Now if I place this back, it's a lot easier. We then have the spinous bits at the back, which we palpate. When we're palpating, when we're running our, so this is a posterior view, the other side was the anterior view, this is a lateral view, and when we palpate somebody from the back, you can feel these processes. These are the spinous processes. Then we have the transverse processes. So if we go back from a posterior view, you have the processes over here. These are only palpable by refined skill, very refined skill, because you have lots of the lumbar erector spinae, the muscles, the back muscles all sit in this region here, so it's rather difficult to feel. You then have the laminae over here. This part over here is what we call the laminae, and then on this, over this area here, you have the pedicles. So go from a superior, there's the pedicles. You have the actual spinal canal through which the spinal cord runs. Of course, in the vertebral column there is no spinal cord. Just to remind yourselves, the spinal cord starts to finish off at rather like our pen over here. In fact, if you notice, the pen becomes cone-shaped at the bottom, and that's what we call the conus medullaris in the spinal cord, and this region here starts at T10, and by about L1 it finishes, after which it becomes literally branches off the actual spinal cord, which resembles your horse's tail, hence the term cauda equina. Equina refers to horse, so that's after that region becomes the cauda equina. Keeping to the anatomy over here, the vertebral body is weight-bearing portions, and here we have the facets. So here we have articulating facets. So the vertebrae from the vertebra above and below actually articulate with one another. So if I show you, just focus on that bit over here, you can see, and it is these facet joints, what we refer to as facet joints. So you heard of facet joint injections, that's where you get those. The facet joints actually are oriented in different regions of the spine in different angles. So the formal name for the facet joint is zygapophyseal plates or zygapophyseal joints, but you have the superior articulating facet over there, as you can see, and that articulates with the inferior one here. And rather important also from a clinical viewpoint is as the two vertebrae come together, they form a little hole over here. So and that hole is through which the spinal nerves exit, and this is what we call the intervertebral, because it's between vertebral, between the vertebrae. Foramen, a foramen or foramen is a hole, and these are what we call the IVF, the intervertebral foramen, through which the spinal nerves exit, and it is in this region here where you get the entrapment of nerves. So if I use the other side, they have demonstrated here rather well a disc herniation. So discs, remind ourselves, come in three various forms, the bulging of a disc, and you can have a simple herniation, which is a slip disc or a disc bulge, that can become prolapsed, whereby, if I may put it in inverted commas, it may shatter, so to speak, so the fibrosis here, the annulus fibrosis may shatter. And then finally you have the sequestration, which is where the liquid center of the actual disc seeps out, and it occupies this area here in all that spinal canal, hence spinal stenosis. Stenosis means narrowing, and that's the sequestration. Just to remind ourselves, disc bulge, usually they occur in a posterolateral, so coming from here, they go in either posterolateral in that direction, or they go in that direction, thus compromising the actual the spinal nerve, and it gets caught. I hope that helps. Any questions, don't hesitate to ask. Thank you.